Hello, my name is Collins Nelson, and I'm going to be presenting on the World Health Organization today. I hope everyone can hear me. Okay, I'm trying the record thing on Google Slides, so we'll see if it works. But the World Health Organization is really an interesting organization, and I just wanted to start why I picked it. It's mainly two big reasons. First, the World Health Organization, I think, is a good example of international coordination happening every single day across the globe. It doesn't matter what country you're in. I guarantee you that there are aspects of your life that the World Health Organization has had an impact on. I also thought that it was interesting because there's a lot of politics surrounding this organization specifically. We know that when we talk about international organizations like the United Nations, there are always things that may be happening there, but the World Health Organization recently, I'll talk about it a little bit later, has really come under fire. So, why was the World Health Organization created and when was it created? So, the World Health Organization, I'll just call it the WHO because it's a lot easier to say. But the WHO was created in 1948, and it was created along with the United Nations. Shortly after World War II, we all have been learning there's this really important effort across the globe for more international coordination and collaboration. And the World Health Organization is created as kind of an offshoot of the United Nations. Now, that doesn't mean that United Nations as an organization and I mean like the General Assembly, it doesn't mean that they are the ones that tell the World Health Organization what to do all the time. I like to kind of think of it as a governmental agency here in the United States. You can look at something like the EPA or the IRS, and yes, Congress, which is comparable to the General Assembly of the United Nations, does kind of pass laws and things that those agencies carry out, but for the most part, those agencies they act independently. So the WHO, they run on their own, and occasionally the General Assembly will give them input of things that they want to work on, but they're really an effective organization, I think, because of that. So 1948, you can read the quote right here. This was kind of the mission statement of the World Health Organization. Together, we coordinate the world's response to health emergencies, promote well being, prevent disease, and expand access to health care. So, the World Health Organization is made up of around 8,000 professionals, and it's the world's leading public health experts. There's doctors, epidemiologists, scientists, managers, all kinds of different things, HR personnel, governmental relations. And really, what they're focused on is coordinating kind of exactly what that quote says the world's response to health emergencies, promote well being, prevent disease, and expand access to healthcare. So, kind of the goal here is that by connecting this international vision around health and kind of the importance of health, everyone, every global citizen will have an equal opportunity to a safe and a healthy life. So, whenever we're really talking about the WHO in when it's in action, we aren't really talking about kind of just the building that's over in Geneva. It's like a bureaucracy there. No, what we're talking about is scientists, epidemiologists, people, teachers, educators all around the world who are part of this unified vision of promoting health. So next, I just wanted to talk a little bit about, so this is the current WHO Director General, Dr. Tedros Adhanom Ghebreyesus. I'm sorry, I cannot pronounce that, but this is a quote from him that I thought kind of shared exactly what the organization does. Our vision remains the same as it was when we were founded in 1948, the highest attainable standard of health for all people. So you can finish reading that right there. But basically, the vision of the WHO is that the world is changing, but the health of people isn't quite keeping up, and it should be. So we've talked a little bit about why the World Health Organization was created, what it is, all of those doctors, everything around there, and then kind of the mission statement. We've talked a little bit about the Sustainable Development Goals with the United Nations. What they are is they're kind of the main focuses of the organization. So these are the three, I talked about a little bit, the three main priorities of the World Health Organization, and these are called the 3 billion targets. So you can see there, it's kind of little on the screen, but there's 1 billion in each category here. And the hope is that 1 billion people will have equitable access to health and well-being. 1 billion people will have universal health care coverage, and 1 billion people will have easy access and care in time of health emergencies. So these three goals all make up kind of the sustainable development goals of the United Nations. Now, you can kind of see already that where there may be some kind of political friction with the World Health Organization and other countries. The health and well being, I think, is very, very standard. Everyone around the world wants to be healthy. Health emergencies, I think, is also very similar. But the universal health care coverage, that one is a little tricky. And that's a fundamental principle of the World Health Organization, is that people should be able to have access to healthcare as a human right. So I hope you can kind of already see where there may be some political friction here. Now, I wanted to talk a little bit about with organization. I know I only have 10 minutes, but I wanted to talk about some of the successes and failures. I said earlier that I think this is one of the most effective branches of the United Nations, and I think it's one of the most effective global coalitions. So, the World Health Organization, it's been responsible for many, many successes. One of the biggest ones is the eradication of smallpox in 1977. So you can see the picture there of the two boys. One has smallpox, one does not. Smallpox, it is estimated to have killed over 4 million people collectively. It has wiped out entire populations, and it's an incredibly dangerous disease. And the WHO is given the majority of the credit for successfully eradicating that due to international coordination and cooperation. So whenever I hear people grumble a little bit about, oh, well, have they actually done anything? Because that's something I think that comes up a lot in today's politics. I say, well, yeah, I mean, for starters, they've eradicated smallpox, which is huge. Another huge success that I want to talk about too is the response to the H1N1 virus in 2009. So this, you can see the female soldier right there. She's giving a shot to a civilian. So this is H1N1. It was an incredibly communicable and an incredibly dangerous disease. And due to international collaboration, the disease was solved quickly and effectively. And there were not very many casualties from it compared to things like smallpox or COVID. So both of those represent what successful global collaboration can look like. I did want to just point out two recent challenges, though, with the World Health Organization, which have led a lot of people to discredit it. The first is the Ebola outbreak of 2014. The World Health Organization refused to acknowledge the disease as an outbreak until many months had already passed, leading to many casualties. A lot of people were frustrated because they felt that this was politically motivated. And there were actors in the World Health Organization who did not want the organization to recognize this as an outbreak. So luckily, you can see the picture of President Obama there. The United States quickly stepped in because there was a lot of political infighting at the WHO, and was effectively able to administer vaccines and provide medical care to many people. So that was one of the times that the military was actually deployed solely because of an infectious disease outbreak. I also just wanted to talk a little bit about COVID, which is, I would say, one of the biggest criticisms of the World Health Organization. There are some ties from the General Assembly in the United Nations to the organization that can hinder its ability. When COVID was recently, when it had just barely started in China, we know that there were efforts from the Chinese government to kind of to keep it quiet. And part of that political pressure from the United Nations and from China, who's a Big Five member, stalled the efforts of the WHO. And this, I think, was caused by a lot of different factors. But I think one of the biggest ones was the kind of changing international dynamics that the world is experiencing today. So the WHO was reluctant to recognize the disease, mostly because of China. It was just, that's kind of how it was. And a lot of people were really, really upset with that. I did just want to point out that a little executive order here, kind of the future of the World Health Organization. But you can see this executive order from January 20th. President Trump effectively withdrew the United States from the World Health Organization. And this is going to have quite an effect on the organization. like I said, the United States provides the majority of funding to the World Health Organization. Um, I'm not sure what the future of this organization will look like, to be honest. I do find a little hope, though, in thinking, like, for example, with the actions of President Obama during the Ebola outbreak, I think demonstrated that the United States was and still is a key player in global health. But I'm worried that completely withdrawing the United States will really, really hamper the organization and its goals. So you can just read a little bit more about this right here, some of those political factors. But in closing, the World Health Organization is a very, very integral part of global health. And like we talked about, some of those goals and those international standards that they have are incredibly important. So I just wanted to include some of my notes right there for you as well. I tried to make it so that the links would work if you wanted to click on them and read a little bit more, but thank you.